Hi, everybody. Welcome. Good afternoon, and welcome to our quarterly virtual estate planning webinar. We're so delighted to have so many of you joining us today. We had over 500 registrations for this event today, which is a new record for us. My name's Kara McDonald. I'm the Director of Philanthropy and Plan Giving at the Seattle Public Library Foundation, and I'm pleased to be joined today by my friend and colleague, Cindy Sherrick, the Director of Donor Relations at the King County Library System Foundation. Our foundations have been collaborating for more than 4 years now on events like this. Just one example of how our libraries often work together to increase the public's access to free library programs.
Thank you, Kara. I'm going to run through a few items of note for today's webinar. First of all guests are muted and all cameras are off other than our panelists to limit background noise and distraction. We're recording today's presentation, and we will send a link to this recording as well as some other great material after we wrap up. At the end of Janet and Lisa's presentation, we'll have time for Q&A, and I will pose those questions on your behalf. To ask a question at any point, please use the Q&A button at the bottom of your screen, or it may be at the top if you're using an iPad or an iPhone. We'll get to as many questions as we can during the Q&A at the end. You'll also see a chat function, which some staff will also be moderating. So if you run into any technical difficulties, please use chat instead of Q&A to get that assistance. To view closed captioning of this presentation, you can navigate to the closed caption button that's at the bottom of your screen and select Show. I think it says CC Live Transcript at the bottom of your screen. Should be pretty easy. Finally, when you sign off today, you'll be prompted to take a quick survey about your experience. We really encourage you to take a few moments to complete this. It helps us shape future events, and to sweeten the deal, everyone who completes the survey will be entered into a drawing to win a book bag. We know you like books. If there's any questions you have that don't get answered during today's session, you'll find contact information at the end of the presentation. We're happy to connect with you one-on-one after this to answer additional questions.
Cindy. I'm going to tell you all a little bit about our foundations now, but I'm also going to keep it short so we can get into this huge list of questions that we have for our speakers today. What we really want you to know is that both of our foundations support library programs beyond what public funding alone supports. And since this is a plan giving seminar, it's also worth noting that some of the most generous and transformational gifts that both of our organizations have received have come in the form of bequests. Foundation funding was especially important over the past year when our libraries were closed. Foundation dollars allowed our libraries to regroup and come up with new ways to serve the public from a safe distance. And we're just so excited that they're starting to reopen again.
For many people, planning for the future can be intimidating and confusing, especially at times like this. But it's certainly something that's on everyone's mind. We've learned that Google searches for how to make a will are up 50% in the last year alone. So if you're thinking about this now, you are not alone, and that's where our today's speakers can help. Lisa Mayfield is the founder and co-principal of Aging Wisdom, an aging life care practice in Seattle. She brings over 2 decades of experience working with older adults and their families, and she is the past president of Aging Life Care Association Board of Directors and serves on the board of Wellsprings Family Services in the Rainier Club. So please join me in welcoming Lisa to the screen now. Our other panelist, Janet L. Smith, founder of Northwest Elder Law Group PLLC, is an attorney providing services in elder law, estate planning, estate administration, guardianship, and elder mediation. Janet received a law degree from the University of Washington School of Law and has a certificate in gerontology from UW as well. She's a frequent speaker on elder law topics. Welcome, Janet. And now I'm going to turn it over to our presenters.
So I'm going to stay and have some fun here with Janet and Lisa. As I said earlier, we have more than 500 people sign up to attend today, and we received a lot of great questions in advance. So I'm going to ask Janet and Lisa some of the most common questions that they tend to hear in their line of work, as well as questions that were submitted beforehand by attendees. And if you don't hear something that you want to know more about, be sure to put it in that Q&A box, not in the chat, but the Q&A box so we see it, and we'll get to as many questions as we can at the end. So let's kick off with a question for Janet. What are the basic legal documents that all adults should have?
Thank you, Karen. I'm so glad to be here. And this is really a great topic that we love to talk about. Most people, when they think about the most important estate planning document, most people will think of a will because that's what we're the most familiar with. But in my opinion, if you're only going to have one or two estate planning documents, the most important ones that every adult over the age of 18 should have are durable powers of attorney. This might be in one document, it might be in two documents. There's a durable power of attorney for finances and a durable power of attorney for healthcare. And these really are the most critical documents that everybody needs because anything could happen to any of us at any time. And I even tell my clients to bring their kids in when they turn 18 to do a power of attorney so that if they have an accident or an illness while they're at school, that there's someone there that can help them. A will is also a very important document, especially if you have assets and if you want to leave those assets to someone other than your next of kin. There's a default setting for if you don't have a will, your assets go to your next of kin, but a will is a great vehicle to direct and make your own choices about that. And finally, I saw a question pop up right away on the Q&A about whether a trust is necessary in Washington. And for 90 to 95% of our estate planning clients, we do not recommend trusts. The primary reason for that is that the main benefit of a trust is to avoid probate. And while I won't get real deep into that topic, probate in Washington is pretty simple and straightforward, and a trust is overkill. Where you're spending too much money to avoid something that you don't really need to avoid. So the answer is, for the vast majority of our clients, we don't recommend trusts. There are some specific circumstances, and that's something that you can speak to an individual attorney about.
Okay, thank you very much for that great answer and for keeping an eye on the Q&A, which is, it's hard to multitask. All right, next question is for Lisa. As someone thinks ahead to a time when they might need some help with care, what options are available to them?
Right, and I was thinking back to the name of this presentation is actually the power of planning, and there is great power in planning and thinking ahead rather than waiting for a health crisis to dictate your options for your care, which with a health crisis greatly limits the options available to you. And I'm assuming that most people joining us today probably assisted their own parents when they needed help when they were aging. And I would anticipate that most of those parents did not plan and that they waited for that crisis to happen, leaving their adult children to scramble and make decisions on their behalf, which is so stressful for the family. So I anticipate that all of you are joining us on this gorgeous sunny afternoon because you don't want to wait for that crisis and you do want to take a different path to plan. So when you are thinking ahead down the road, what options are available, the two biggest choices to start with are, do you want to stay at home and have caregivers in the home helping you, or do you want to move to a retirement community and be around other people and have, you know, that balance of independence versus assistance? And so if you want to be at home, it's thinking about what would it be like to have caregivers in your space and lack that privacy. Do you have room for the caregivers? Is your house set up to navigate as your mobility declines? And do you have the financial resources to pay for that help? Or do you want to move into a retirement community and thinking about where might that be? What kind of environment would you like? What features would you want in that community? And what is in your budget when you're thinking ahead to a community?
Okay, lots to consider. Let's see, next question for Janet. What should I consider when choosing a power of attorney? And part of this, there was a question posed in advance by an attendee. What do I do if I don't have any close family or friends who could serve as a power of attorney?
That's a really good question, and we get that quite a lot in our practice. There are more people than you know that either don't have family to serve in that role, or their family doesn't have the right skill set to do that for any number of reasons. And that is the most important thing to think about is, does this person have the right skills to do the job, and do I trust them? A power of attorney is a very, very useful document because it's very easy to set up, and it gives your agent broad control over your assets or your medical decisions. That being said, there's no power of attorney police that is going to be looking over their shoulder and making sure that they do a good job, often until after damage has occurred, that a complaint is made if someone is taking advantage of that document. So the most important thing is to choose someone that you trust, someone who can follow directions and won't just go off on their own tangent, and who has the time and the ability to manage the task. What people typically do, what we recommend to our clients who don't have family or friends who can do that, is that there are professional fiduciaries. And these are not just for people of high net worth. Certainly, there have always been trust companies and large financial institutions that will manage high net worth clients. But for clients of ordinary means, there are professional fiduciaries that charge on an hourly basis. And both Lisa and I have a lot of clients who work with professional fiduciaries to be the son or daughter that they don't have, and to make those decisions for them. And so this is a really great option. For the most part, attorneys don't do this any longer. They did in the past, but that's now considered not really part of our role. So we regularly refer our clients to professional fiduciaries if they need someone for that role.
Okay, and there's a question that came in the Q&A here that says, who is your next of kin if you're unmarried and have no children? So does it default to someone, or what happens in that case?
There is a state statute that defines next of kin in order. If you have no spouse and no children, the next in line would be your parents if they are living. And if your parents are not living, then it would be the children of your parents, in other words, your siblings or their descendants, so nieces and nephews. And if you have no siblings or nieces and nephews, then it goes out to cousins, and on and on and on, the pebble in the pond making ripples. Almost everyone has next of kin. You may not know them. They may not live in this country. But for the most part, if an heir search needs to be done, almost everyone has someone that can be found that is related to you.
Okay, and another question related to this, does the power of attorney have to be a U.S. citizen or a permanent resident of the U.S.?
That is a tough call. I believe that, I know that an executor of a will does have to be a U.S. resident, not necessarily a citizen. I can't recall off the top of my head if an agent under a power of attorney has to be, but there certainly could be some problems with financial institutions if they were not. So that would be something I'd research on a case-by-case basis.
Got it. A tough one. Okay, next question for Lisa.
If I can amend that answer,
of course,
if the person is a U.S. citizen, perhaps you have a son or a daughter who lives out of the country, they most certainly could serve as your agent. There would be no problem with that. And we have had that happen quite a bit.
And I will jump in to say, I think Janet and I have had several shared clients where adult children or relatives that are assisting clients have family members living in Norway. I had a daughter who was a researcher in Africa. I had another daughter that was living in Nepal, helping people with climbing. So you can name people that happen to live out of the area. And that's a time when having a care manager that can be boots on the ground to help manage healthcare decisions, or having a professional fiduciary like Janet mentioned. And Janet and I both happen to not have children, so we have great empathy for people joining us today who, when they think ahead about who's going to be that person making decisions on my behalf, we're both also in that same boat.
Got it. Thank you. Okay. Next question is about moving from home and how you make a decision. How do you decide when or if to move from your home? And then related to that, Lisa, if I could ask, there's a question in the Q&A about someone who's having trouble finding information on 55 plus active living communities in this area. Where can they find more information on that if they choose to do it?
Great question. So when I think about many baby boomers that we're working with are thinking about that exact question. Should I move? Should I not move? My neighbors are moving. I don't know if I want to move. I think things to think about are, do you have the time, inclination, and capacity to, if you live in a home, manage your yard and all the yard work? Is taking care of your home starting to feel too much? Those are questions to think about. Also thinking about the setup of your home. Is it geared toward the day when you'll need more help? I've worked with clients where the bedroom's up a big flight of stairs, or the laundry is down a really steep set of stairs to the basement. Maybe there's no bathroom with a shower on the main floor. So really thinking about your home setup. I also think thinking about one of the common challenges as people age is at some point in time, there's often a time when driving no longer makes sense. So where is your home? Can you easily access a grocery store, your doctors, where you're going to get your hair cut? Like, how would you navigate getting around without transportation? I also think about, especially during COVID, we've all been increasingly aware about the negative impacts of isolation. So many people think they want to stay at home for the end, but I really worry about isolation and lack of social contact with other people. So I think that's a key thing to keep in mind as well. And then just how people would feel about having caregivers in your home. I think it sounds good as a concept, but many people end up not liking people in their space and feeling like they're lacking privacy in their home. So those are questions I would think about. My parents are actually on this call today, and they're a perfect example. They live up in Skagit Valley, and they live on 10 acres on the Skagit River. They have a fairly large home, and so they've been thinking about, their grocery store is probably 20 minutes away. I think their doctors are 45 minutes one way. They love doing their gardening, but it's starting to feel like a lot of work. It's starting to impact the time. They'd rather be spending time. I wish I had grandchildren for them to spend time with, but they'd rather be traveling or doing other things rather than all the time it takes to work on a yard. And so they're thinking about moving closer so that they can have things more accessible to them. So I think they're a perfect example of what people are thinking about as they think ahead to making their life more simple.
Got it. And if I can throw another question from the Q&A at you. Somebody asked about average costs of living in retirement communities, first in independent living and then assisted. Is that something you feel comfortable speaking to, or is that kind of too broad? It's case by case.
It's a huge question, but I can answer in generalities. First of all, it really depends on where you live. So the closer you are to the heart of Seattle or Bellevue, the more expensive. The further out you get, the much less expensive. In Seattle, I would say the cost of care has really skyrocketed I've been doing this work for 18 years, and really the last 2 or 3 years, we've seen costs really escalate. So we can see care, if you're living in an independent community, not needing help and just rent, maybe it could be as low as $3,000 to $4,000 a month When you start to need care and assistance, it can escalate to as much as $15,000 a month. So a pretty big range and pretty staggering numbers when people hear about it. There was a part of that question also you said, did I answer all the question? I think that was it. Oh,
Yeah.
somebody had asked earlier, I think, or I'm looking in the chat about how you find communities. And there are lots of online directories that you have in our area. Sound Generations is a great resource. Care managers like myself are experts on the communities and helping you narrow down which might be a good fit based on your personality, your care needs, and your finances. You want to move into a place that you can afford over the long haul, and care costs will always escalate over time. So having a professional help you kind of determine what costs might be so you can create sustainable plans are important. Also, the Department of Health rates communities, so you can Google search there to find local communities in our area as well.
Got it. Thank you. Okay. The questions are coming fast and furious into the Q&A, which is fantastic, and we'll try to keep up, but we are leaving time at the end. So if you don't hear us get to them right now, rest assured we'll do our best. Janet, next question for you. How can people ensure that they have control over their end-of-life decisions?
This is an area where I would say the law is on your side, because the law favors autonomy and favors the right of an individual to make their own choices regarding both end of life decision making and funeral planning. So you can, starting with that, you can put in writing your designation of who can make your funeral arrangements, and in terms of deciding cremation, burial, or other, there's lots of other now. And if you put that in writing, and if you put your wishes as to what you want in writing, and that document is witnessed, it doesn't need to be notarized, just witnessed, then your family can't change that. That's what's going to control, and that's what's going to take place. In terms of actual end-of-life wishes, in terms of your care at the end of life, that again, there's a strong bias towards honoring the individual's wishes. That's where the laws came from that created advanced healthcare directives. Your advanced healthcare directive is primarily a document that gives instructions to your designated healthcare agent, the person in your healthcare power of attorney. The doctors won't actually read that healthcare directive. They're going to go to the agent and say, what should I do? And the agent is guided by that healthcare directive. That's different from a POLST form. POLST stands for Physician's Orders for Life-Sustaining Treatment. That is a form that you fill out in consultation with your doctor, and you discuss your end-of-life wishes in terms of whether you want CPR, extraordinary measures, a whole list of checkboxes. You discuss that with your doctor, and that form is a present tense form. When you sign it, it's, if I'm dying in the next 5 minutes, this is what I would want. And so that's absolutely a present document. You sign it with your doctor, and that has the force of a medical order. So the EMTs, the first responders have to comply with that form. The Advanced Healthcare Directive is a future document. That document says, if in the future I am dying or in a permanent vegetative state, then this is what I do and I don't want. So that's how those documents differ. In order to make sure those documents are carried out, you first of all, again, coming back to trust, you want to name the healthcare agent that you will trust to make the decisions as you would have made them. It's a test of substituted judgment. They stand in your shoes. So if you have a family member who may be very knowledgeable about medicine, but will not follow your wishes, they're not the right choice for you. You need to choose someone who will follow your wishes. And then you need to make your wishes known, whether it's formally in an advance directive or just writing a letter or just having a conversation. tell your agent what you want. And finally, I would say in terms of family conflict, if you believe that your entire family is not going to be on the same page in terms of end of life decision making, either pick one person to be your healthcare agent, or if you have multiple agents, you pick one person to be the tiebreaker. And that way, you know that if there is a dispute, that one person will get the final say, and that's what's going to happen.
Okay, thank you. Our next couple of questions, I wondered if you could both tag team. They're both about finances. So for Lisa, what costs should people consider and be prepared for as they age? And then for Janet, who can help organize finances? And there are a lot of questions in the Q&A about not having enough money for end-of-life care. We can get to those after you start off with those first two questions, but this is a big one that's on people's minds.
Right, right. And I thought of the resource that I was trying to think of earlier, and it's Genworth Financial. They do a cost of care analysis each year. So they do some generalities about costs to expect, and you can actually look up by city, and then they divide it whether you're looking for caregivers, skilled nursing, or assisted living. So that can be a great resource as well for getting just a general sense of care costs. We often find that costs are much higher than we find in their survey, but I think it's a good baseline. I guess I would say, again, costs really depend on how close to a city you are versus how far out you are. When you're touring communities, there are two things that you really pay for. One is the rent, which covers the room, as well as the basic aspects of that community, which includes, food, some light housekeeping, activities, maybe some transportation. Once you need care or once you need assistance, whether it be helping with dressing or maybe taking a shower or navigating the building, there are additional costs for the community to provide that care, kind of how they compensate paying caregivers to provide that care. So when you tour, you'll often be told a price, and that may sound pretty reasonable, but what they're likely neglecting to have full transparency about is what are the care costs, and what are the care costs when you need a little bit of care, and what might those costs escalate to when you need a lot of care. So really trying to get a sense of the costs now when you move in, as well as the future costs. I would say in great generalities, if you are home and you're having caregivers come into the home, you typically are paying caregivers by the hour. And again, these costs will vary city or out of the city, but in general, I would say Seattle is around $25 to $50 an hour. So when you need a little bit of care, which most people start with a little bit of care, it's quite affordable. It really becomes unaffordable to a lot of people when they need a lot of care, like 24/7 care, around the clock care, which in the Seattle area can escalate to $15,000 to $20,000 a month. So really kind of scary numbers to people. And I think I saw a long-term care question in here. So people will often ask, who pays for care? And they might think Medicare pays for care, but in general, the easiest way to think about Medicare is it's a health insurance. So health insurance would not typically pay for caregivers. If people have been fortunate enough to purchase long-term care insurance, that's another resource. Or if you're helping your parents trying to discover if they have long-term care insurance, which is insurance that usually pays an amount, they call it a daily rate, but it theoretically it's amount they'll pay each month to help pay for care, whether it be caregivers or the retirement community that you're living in. And I think somebody was mainly into longer been overwhelmed by, and Janet's a great long-term care insurance expert. I mean, do you want to take this, since I've been talking about cost of long-term care insurance? Or
yeah, long-term care insurance is very expensive, and a lot of that has to do with the fact that people use it. If you purchase long-term care insurance and manage to keep paying the premiums until you are in your 80s, there's a very good chance you're going to be able to get some benefit out of that policy, because you don't have to be completely nursing home eligible to use the benefits. You have to either need substantial supervision due to a cognitive impairment, or you need help with either 2 or 3 activities of daily living, such as bathing, dressing, transferring, eating, toileting, continence. And so if you think about someone who's living in assisted living with serious rheumatoid arthritis and a little bit of a fall risk, they would probably be able to qualify for long-term care insurance benefits, because they need assistance on a regular basis with bathing and dressing. So it's a good thing to have if you can afford it. I saw in the Q&A a question about the new payroll tax. This is, I'm only going to touch on it briefly because it's a little bit beyond our planning topic here, but any legitimate long-term care insurance policy will qualify to opt you out of the payroll tax, as long as it's, I believe it has to be equivalent coverage, which is, you know, $36,000 of benefits. So if you are under 50, there's going to be a very good likelihood that you can purchase something that will give you more coverage than the state benefit that will pay out $36,000 if you're still living in the state of Washington at the time you need it. So I think anyone under 50 should talk to an insurance broker and find out what your options are and what's out there. If you are over 65, you're probably going to find that the long-term care insurance is too expensive. If you're over 70, it almost certainly is. So if you're in that in-between area of 50 to 65, yeah, still call a broker, find out what's out there, find out if it's something you can afford, and make a decision based on that. Getting back to the earlier question about finances and organizing. Organizing your finances, the first step is you helping the person or the people you've named as your agents and your power of attorney. This doesn't have to be an onerous organizational task, but you think about what would happen if you were in an accident today and someone needed to step in with no guidance as to how to pay your bills and manage your affairs. It would be hard. If you had at a minimum a note that said, here is where my bank accounts are. Here is where my investment accounts are. Here is the name of my long-term care insurance company. These are the bills that I regularly pay. This is where I keep my check register. Most of my bills are paid out of the blah-de-blah checking account. Simple notes like that you could probably do in your head right now would speed up the process immeasurably, because you don't need to leave balances, you don't need to leave account numbers. Your agent would be able to get all of that as long as they know what institution to ask. But if they don't know where you bank, then it's going to be a long process of trying to find out where those accounts are. Think about providing a safe way to give access to your password protected computer and all of your accounts. If all of the data that you have is on your computer, think about a way that you would be able to share that with someone if they had to take over for you. Getting to a larger, I suspect that the person who asked this question maybe was feeling overwhelmed by organizing finances. And so this would be where professionals would come in. If you're trying to plan for what can I afford for retirement and or long-term care, I think a good place to start would be with a financial planner who regularly works with people at or over retirement age, so that they can help you really do the numbers to see, what money do you have to live on now? What money do you have for the future? This is a great resource. They have wonderful tools and models that they can plug your data into, and it spits out a report, and they can say, okay, you know, we need to tighten your budget a little bit, or yes, you're perfectly okay. You have more than enough money for your long-term care. Why don't you take more trips? So a financial planner is a great place to start. For nuts and bolts organizing and bill paying, there are people who do that. Sometimes they're called daily money managers. So you can Google that term. And these are usually individuals who just like helping people organize their paperwork and pay their bills. And they will often come to your house and sort out the shoeboxes full of bank statements and receipts and come up with a nice organizational plan. And that can be a really nice kind of person to work with. I think that's about it on the oh, and if you have to downsize and move from the 10 acres on the Skagit River, there are many types of professionals that can do all of the tasks involved in helping you downsize, helping you organize what to take with you, helping you sell what you don't need, and then getting it from point A to point B.
Got it. And there are a couple more questions coming in about financial items, but I wanted to get to and we'll get to those soon. But I wanted to ask this next question because it's a question we get a lot, and I've seen some in the Q&A. Janet, how often should someone update their legal documents? And then a question we almost always get at our webinars is, do your documents follow you across state lines? You know, if I move to Florida, do I need a new will? How does that work?
So there are simple answers to both of those questions. Your estate planning documents do not expire. If you did them 40 years ago and they still express your wishes, they are valid and have to be accepted, even if a financial institution looks at them and says, oh no, this is too old, we need something more current. Sometimes that's not possible. If the person who created the document no longer has capacity, that's what you've got. So the documents never expire. And yes, they cross state lines. If you think back to your civics class and the full faith and credit clause of the Constitution, a contract that is executed in one of the states will be honored in any of the other 50 states. And I say states because that's a US thing. Your will not necessarily be valid for your assets in Canada. So if you have out of the country assets, you need to speak with an attorney who specializes in cross-border estate planning. But for all of the 50 states, yes, the documents are just fine and will be honored in the new state. Now, if you need to update them, say I prepared your estate planning documents and you decide to move not very far away, you just moved to Oregon. And you call me up and say, well, Janet, I want to update my documents and it's only a 3-hour drive. I'll come back and see you. Unfortunately, I'll have to say no because I'm not licensed to practice in Oregon. So I can only write estate planning documents for someone who has at least some residency in the state of Washington. I have an awful lot of snowbirds who live in Washington and another sunnier place, but you have to have a residency in the state for an attorney in that state to do your estate planning documents. So to update your documents, then you would want to see an attorney in that state. And typically when people call me and say, I'm going to be moving in the next 3 months, I want to get my estate planning documents done, I will advise them, you know, it's going to be more convenient for you to do that in the state where you're going to be living. And so I would advise them to do it when they get there with an attorney in that state. The fact that the documents don't expire doesn't mean it's not a good idea to update them if you can, if they're very old. Powers of attorney especially, because these have to be accepted by the financial institution, and financial institutions can be very difficult sometimes. So we advise if your power of attorney is over 10 years old and you can update it, it's a good idea to do that. Other than that, pull your documents out every few years. Make a careful note about where you keep the originals. The law is still pretty archaic and photocopies might not be good enough. So it is important to know where those originals are. and take a look at them. And if something needs to be updated, then go ahead and take care of that. But as long as your wishes don't change, those documents will be valid indefinitely.
Good to know. And a civics lesson too. Thank you. Lisa, next question is for you. How do I make sense of all the end of life care options?
Well, great, great question. I think there are a variety of ways. There are people like me all over the country that can meet with people and help that you make specific plans based on, again, where you might live, your preferences, your finances. Sound Generations is a great resource in the Seattle area that can provide lists of communities helping you make sense. The Alzheimer's Association is a great resource as well. They have care consultants. Elder law attorneys like Janet can be a great resource when you're trying to tease out all that's going on. So I think it can be overwhelming. I think it can be well worth having a professional help you make those plans so that, again, that if you are, sometimes I can't believe the amount of money, how quickly people might make a decision about a retirement community and the amount of money they might put down into that community without ever really doing much research about, what is this community like when I need help? What are their costs that I might expect that they didn't tell me about? Just doing some due diligence before you make such a big commitment.
Got it. Thank you. We have just over 15 minutes left and lots of questions in the Q&A. And then we also received a lot in advance too. I'm going to invite Cindy back on to ask one of the questions and give us all a chance to take a breath here and take a drink of water.
Great job, everyone, so far. So we did receive a lot of questions in advance, and I'm going to read one now. I am 75 years old. I have a history of family on both sides that had Alzheimer's disease, including my mother who died of it. I am a widow with no children. I would like to hear about resources I can access now that would safeguard my assets as well as assure my care in the event I eventually succumb to Alzheimer's. Do you guys want to take a stab at that one?
I think the first part of that question is related to choosing a fiduciary. That I think that if you're 75 and whether or not you worry about a debilitating illness, you should have somebody that you have designated to assist you with financial and medical decision-making in the event that you can't do that. And you can, if it is a professional fiduciary, you can have an ongoing relationship with them so that they know if you're starting to have difficulty, or you can give permission to the people who are around you, whether that's an assisted living facility or a pastor at your church or a friend that you regularly have lunch with, and give those people permission and say, if you notice that I'm starting to have difficulty processing thoughts, this is the person that I've set up. This is who you should call. So that would be a step. And I think that, again, having someone very trustworthy lined up to manage your bill paying, to keep an eye out to make sure you don't get scammed, don't get taken advantage of, these would all be good steps to take.
Thank you. Lisa, did you have anything to add?
I would just make a plug for doing everything you can now to focus on your health. We know that exercise and eating right and social connections and being around people and doing new learning is so important for our brain. And also just echoing what Janet said, if you don't have family members well, first of all, I would say that I think most people, especially if their parents had Alzheimer's, have this intense fear of having it themselves. And it doesn't mean that you will have Alzheimer's just because your parents did. So trying not to, and then I always say there's something else that might get you before Alzheimer's. So hopefully you don't spend too much time worrying about that. And if nothing else, I would say my job where I work probably, I don't know, 99.9% of the time with people that have memory challenges is what it has taught me is the importance of enjoying my life now and focusing on all the things I can do now, not putting things off. And so keeping your joy in the present is so important. But if you lack kids, as we've talked about before, there are professionals like in the kind of work that we do. We work with people who don't have children and helping them navigate their health care. And then there are people that navigate the finances. So there are people out there that can help. And I actually saw a question in the queue. I'm not able to use my computer, but I think it was Cindy doing some research. So I'll say these aloud and maybe she can put it in the chat. Somebody asked how you find the kind of professionals that we've referenced today. So I'm what's called an aging life care professional, and there's people all over the country, and our professional association is aginglifecare.org. So we can put that in the chat. Janet is an elder law attorney, and their professional association nationally is called NALA, National Association of Elder Law Attorneys. And then there's a WALA, a Washington version of that, to find an elder law attorney. And I will just give a plug for elder law attorneys. Most people have heard of estate planning attorneys, and then there's another group of professionals. Janet is an example of that, elder law attorneys. And I think they have because they work with really complicated situations about kind of issues that might go awry in the future, they're able to set up documents that help prevent those challenges that we see time and time again in our work. So a plug for elder law attorneys. And then Janet mentioned the term, the people that can pay your bills, and also fiduciaries. They often fall under the category daily money managers, and their association is called ADAM. And I think Cindy can help us find that. And then Janet, you might be able to help me with this. Somebody asked about finding a financial advisor, and I think, isn't it CFP? Certified financial planners, I think they have a national association.
Yeah, they have a national association. Since that is something local, I would say go with word of mouth for a financial planner. I mean, the aging life care professionals and elder law attorneys, we give out those organizations because a lot of times you need to find somebody in Florida where your parents live, or in Missouri or Ohio. But if you're looking for a financial planner, I would say go with word of mouth referrals, because having a certification doesn't mean that they're going to be a good fit for you. And there's a big, wide variety. I work with a number of financial planners that help my elder clients that I think are very good. And so I think if you talk to a professional in the field, you'll probably be able to get a list of 3 to 5 names of people to check out.
That's great advice. Thank you both for that wonderful answer. Just to plug that Kara and I will be sending an email after this webinar, and it'll have links to all of the websites that we just mentioned. So if you didn't catch it the first time. I do have one other question. Kara, is that okay if I read it? Okay. Okay, so this came from an attendee in advance of the webinar. What happens to folks who move into an assisted living facility with enough money to pay for 5 years, but they live for more than 5 years? Do they have to move out of the facility, or does Medicaid take over payments? Assume there are no family members who can assist.
Okay. I'm going to start this one with a disclaimer that this is a really big topic, and it's going to vary based upon the facility and where you live. The first hard piece of news is that in King and Snohomish County, which is what I'm most familiar with, most assisted living and memory care facilities do not have Medicaid contracts. That's just the hard truth. So there is no period of private pay that if you go into one of those facilities, if they don't have a Medicaid contract, then when you run out of money, you will have to move. That's just the sad story. The flip side of that is that the vast majority, and I would say, in my experience, maybe 90% plus of adult family homes, which provide heavier levels of care, do have private pay periods and take Medicaid. For the very top, the cream of the crop right now, we're hearing that that's about a 3-year private pay before they will let you then convert to Medicaid. And what happens is that if they have promised that if you pay privately for 3 years and then run out of money, that then they will accept whatever rate the state pays, and you will get to stay in that facility. Now, that's not to say that there can't be changes that happen, and this is sad because the consumer often doesn't have very many rights. I would say, as a general rule, adult family homes do not renege on those private pay agreements. It's the standard for adult family homes, and if they did that, they would their reputation would be ruined, and they would not get new clients. Assisted living facilities are, unfortunately, what happens a lot of times is that one company will own a facility and say, okay, we'll take Medicaid after 4 years. And then sometime during that 4-year period, the company gets sold and the new company decides not to honor that. And there's not a lot the consumer can do about that. So it's perilous to assume that an assisted living facility is going to honor that contract. It is generally not perilous to assume that an adult family home will honor it. So that's a short answer to a very complex topic, but it is important to understand when you are looking at care facilities and you look at your budget and you see that you only have a few years of savings to pay for care, you are going to have more choices if you move to a facility while you still have the money to pay privately for a period of time, rather than if you wait until you're out of money and then you have to find a facility that will accept Medicaid from day one. That can be very challenging.
And I will just chime in. I know we're almost out of time to say a lot of people on the call might not know what Medicaid is. So Medicare is the insurance that pays your health care. I know most of you know that. Medicaid is the government area that will step in and help pay for care if you don't have resources. I will also say that we can create plans no matter how much money you have. So if you're leaving this seminar feeling really depressed, just know that there are options for everyone. And I think if you are somebody that realizes you have a limited amount of money, it's even more important to be thinking ahead and planning ahead, because there are strategies that can be done to help you make your money last as long as possible. So that's a good chance to pick someone's brain about, I have this much money, help, what should I do?
Got it. I think we have time for one more question, pushing it a little here, but we're getting a couple questions about care managers. How do you find one? What should you consider when you're looking for one? Can you speak a little bit more about that?
Yes, so care managers, so what care managers are, they're consultants that work with individuals and families on a wide array of issues, from helping you navigate these care decisions to, help, if you don't have somebody, that they can do very much like an adult child might do for you, take you to doctor's appointments, help you find a community, make sure you're getting the care you need. I mentioned our professional association, the Aging Life Care Association. I think that professionals that are part of a professional association, they usually have backgrounds and certification that helps show that they take their profession seriously and have experience. So going to a professional association like attorneys, care managers bill for their time by the hour, so that's how they're paid. And I think it's important to, care managers become a really important part of your life. The other day I met with a client and she looked at me and she said, I was thinking about you last night and how important you've become to our family, that you got to trust your gut and you find someone that you feel a connection with and some trust with. So talk to a few people, interview them, and see what your gut tells you. And Janet, I don't know if you want to, as a former care manager, you might want to add anything.
No, I agree. Interview people and find somebody that you have a good fit with. It really is a very, very personal relationship. I would second the reference to the professional organization. There are folks out there who will call themselves geriatric care managers because they help their grandma. And they don't necessarily have any educational background. They don't necessarily have any advanced degrees. They don't necessarily have any long-term work experience in the field of geriatrics, but they feel that if they helped one older person, that they could help others. And so dig into why the person is calling themselves a care manager and what they've actually done to merit that title.
Okay, great. Well, wow. That was a lot and very, very valuable. I hope you all found it as valuable as I did. I sure took a lot of notes. I want to give my sincere thanks to Lisa and Janet for taking time out of their very busy schedules to share their ideas and information with you all. As a reminder, when this webinar ends, you'll be prompted to take a quick survey, and I'm giving a plug for that. Please fill it out. It really helps us to know what kind of topics you're interested in hearing. You'll also be entered in to win a great prize for any library fan, a bag of books. In addition, as Kara mentioned, we'll be sending a follow-up email following today's event with additional information and our contact information. So look for that soon. Don't forget that a charitable bequest is one of the most meaningful ways you can support the nonprofits that you love, including the library. If you have any questions or would like to continue this conversation, please reach out to me or Kara. Our contact information will be in the follow-up emails. And finally, on behalf of the King County Library System and Kara at the Seattle Public Library System, I want to thank you all for coming today. Take good care.
Thank you.
Thank you so much.
Thank
Bye,
you.
everybody.